we are very fortunate today to have with us two eminent guests and scholars interested in this subject. Dr. Frank Rollier, to my right, is visiting us from Paris, France. He is a clinical psychologist and he teaches in the clinical section, which is associated with the Department of Psychoanalysis at the University of Paris 8. He has already given us an introduction in episode 1 to Lacan and feminine sexuality, and we are continuing our discussion in this session with another very important guest who is with us today on this occasion, Dr. Meenakshi Malhotra. She is a faculty member at Hansraj College, Delhi University, and her areas of interest are gender and feminist theory, and she specializes in literature. So, I am happy to welcome both of you to this program. I would also like to add that Dr. Meenakshi Malhotra is one of our course writers for 3 of our courses for the MA program. She has contributed units in MWG-001, which is the theories course, Theories of Women's and Gender Studies. She has contributed also to MWG-003, as well as she is the course editor for the Gender and Life Narratives course, MWG-008, in which she has not only edited the entire course material, autobiography being one of her specializations, but she has also written 3 of the units herself. So, we are very pleased to have her amongst us today to talk about this feminist perspective on Lacan and feminine sexuality.
Thank you, Professor Anija. Now, I am going to try and map the feminist response to Lacan along 3 axes. One is the French feminist response, which would include Luce Irigaray and Julia Kristeva. The second would be the American response of post-structuralists like Judith Butler, which actually chronologically comes a little later. But also the response from the object relation school, theorists like Nancy Chodorow, who developed ideas of maternal and maternity and took issue with some of the points that had been made by Lacan. Now, as far as a critique is concerned, Irigaray and Kristeva were actually also extending the possibilities of Lacan's work and taking it in directions which are possibly very productive for feminist theory, for women's writing and for gender studies. One of these instances is Kristeva's book, which is called Revolution in Poetic Language. With Irigaray, there is this whole development of this idea of a polymorphously perverse sexuality, the sex which is not one. Now, what Kristeva was doing, for instance, was to look at the possibilities of linguistic utterance before the child accesses the symbolic order. Now, for a minute, let me just go back to these orders as postulated by Freud. These are the oral, anal, Oedipal and phallic. As far as Lacan is concerned, between the 3rd and 4th stage, Lacan theorizes about the mirror phase, and that is probably the most significant moment of self-identification for both the female as well as the male child. This is the point of entry for the child into the symbolic order, into the order of what can be known as patriarchy. It is also the moment when the child separates himself or herself and says I. It is a point of symbolic, the entry into ego identification, the moment of separation from the mother or the significant other. Now, at this point, Lacan talks about the entry into the law of the father, but Kristeva's point, I think, is something that we have to dwell a minute on, perhaps. The idea that the semiotic, the whole question of utterance, is extremely, again, fertile for probably the language of the hysteric. The hysteric who does not necessarily speak in the, whose placing in the symbolic order is at times uncertain. So, this is probably a point that we could pick out for discussion later. What is the language of the hysteric? Because one theorist, Juliet Mitchell, says that the novelist in 18th, 19th century England is the female novelist is always speaking in the voice of a hysteric. Why is this the voice of a hysteric? Because the woman novelist is speaking from both within the symbolic order as well as disputing that order. She is speaking from a pre-Oedipal order as well. And she then maps out this discourse in Emily Bronte's Wuthering Heights. Now, coming to the second prong of my argument, which is to do with Judith Butler and the American post-structuralist school. This is really, they're saying a lot of things, but one of the things that I think is productive from our students' point of view is probably also the question of Lacan's reinforcing of certain ideas of the symbolic order also seems to keep reinforcing heteronormativity. The fact that the given order, the law of the father or the phallus as a signifier is always already within a kind of, the phallocentric order is necessarily also a heteronormative one. Now, to what extent would this kind of theorizing on Lacan's part be a positive direction for queer theory or queer rights? Because a very important part of women's and gender studies is the question of queer theory, and it's also the problem of the subject. On the one hand, the subject can be endlessly analyzed or theorized, or you can talk philosophically about the subject, but you also need the concrete historicized subject. And Lacanian psychoanalysis seems to be very, very ahistorical in its approach. Now, I'll just move on to the next. I think we'll have to come back here, but the next, from the object relations school, which focuses on mothering, the reproduction of mothering, you have a problem because, and this is part of the critique, that the mother in Lacan is still very much a part of the real order of things, and the father is in the symbolic realm. So, isn't there a slide from the real to the symbolic registers, and very often an eliding of issues from one order to the other? So, the mother is always in the realm of the need, realm of the real, whereas the father is reified, dematerialized, and accesses the symbolic order.
Some very interesting issues. Would you like to respond to that, Dr. Ollier?
Yes, certainly. Thank you very much for your questions. And what I would say first is that Lacan stressed upon the symbolic order at the beginning of his teaching. Then, in his late teaching, he put the accent of the real rather than on the symbolic. And that does have a lot of consequences on the analysis, the process of analysis, and especially of analysis of women. Of course, things changed a lot since Freud's time. In Freud's time, he considered that a woman should reach the point of being conscious of her lack and of her rock of castration, as he called it, in a patriarchal way. Lacan is absolutely in another direction. Like Freud, of course, he offers women to speak out, But he doesn't consider at all that being a mother, for example, is the very aim of an analysis. Maybe for some women who can't have a child, it might be an aim, of course. But for the others, it is not the very point. The very point is for each woman to discover what is her singularity, what makes her being a woman, different from all others. And this completely out, separately from the question of the phallic order, and separately from being a mother. The point being that is there femininity beyond maternity? Does that possibility exist for a woman when she have one child or children? Is there room for her femininity? So that's a direction in which Lacanian psychoanalysis works. That's
and also, is the maternal position the position of subjectivity or not? I think your argument was going in that direction, that the positioning of the maternal seems to be in the realm of the real, and the real, of course, for Lacan is that which is inaccessible. So if the mother is inaccessible, who is she inaccessible to? And what about the mother's own position as subject? I think those are some of the issues that the feminists have raised. And I think we also have, and of course you also raised an interesting issue about queer sexuality and the queer identity and where that fits into the Lacanian discourse. Maybe somebody from the audience, I think, has a question.
My question was regarding, again, coming back to the question of absence. What is the lack or absence that Lacan talks of, and how do you make sense of it in understanding Foucault's abnormality?
Thank you. Well, Lacan theorized desire as a lack. Desire is not jouissance. Desire is what you are longing for, and what we are longing for comes from a lack. If there is not this dimension of a lack, you can't desire something. That's the basis. It's not related to one gender or another at the basis. It's something which concerns all people. Regarding Foucault, it will be difficult for me to answer because Foucault mainly denounced the power of establishment upon the bodies of all bodies. And in that way, he was very much skeptical regarding psychoanalysis, although they had Foucault and Lacan, kind of a dialogue, but still Foucault was not on the side of psychoanalysis. That was not his concern. And regarding all the feminist movement, Lacan had this specific place of being a psychoanalyst that is dealing with suffering people. That's the basis. He's not a philosopher. He's not a linguist. He's a clinician. That's very important because very often we have the idea, well, some people have the idea that he is a theoretician of sexuality and so on. First of all, he does hear what women bring. So regarding the question of real and symbolic on the mother or father side, I think things have changed a lot in 21st century. The roles can't be specified that way. At least in Europe, we do have a lot of fathers who look after the children, the babies, and we do have mothers who, I would say, make the law. They are the father. Mother and fathers are functions, first of all. Not only bodies, but functions. Being a father is a function, and it is a function which may be occupied by a man or by a woman. That's what we observe, for example, in gay couples. There is one which plays this function and the other one another function, but not necessarily a woman playing the function of the mother or a man playing the function of the father. And the question of the real our modern analysis aim at reaching that point of real, that point which is beyond words, either for men or women in analysis. And it will have maybe different expressions if it is a man or a woman, but that point has to be reached, which is beyond words. And we do all have something beyond words. We call it a symptom. At the very end of a symptom, you're suffering, but after a treatment or a course of analysis, you will suffer less, but still you will have some residue which maybe you can't put words on it, but that will inhabit you, and that makes you have a symptom. You do have a symptom, I do have a symptom. Maybe my symptom today is I want to be heard by people.
Thank you for that very important clarification from a clinical perspective. We should keep it in mind. You are right. I think we have another question from our audience.
Yeah, I have a question to Dr. Rollier that about you were talking about Lacanian jouissance on most of the feminine sexuality, but over here I have a question on non-normative or non-formative feminine sexuality with the female homosexual couple, lesbian couples. How do they castrate the phallocentric idea of lingam and anandam together without the lingam being a part of it?
Well, you have to say something about lingam and etc. I'm not an expert at all of that, but regarding feminine homosexual couples, we do have, of course, lesbians in analysis, and we, of course, made a point a long time ago not to try to put someone in what would be a normal way, not to be homosexual or not to be this or not to be that. That was in the maybe beginning of the 20th century. And that's a reproach which has been made a lot to psychoanalysts, but it was right to make this reproach. But we don't have at all this approach nowadays. If someone claims he's a gay or lesbian, well, that's fine. We are not going to try to make him change. But what we are going to try, if he's asking or she's asking for that, is to try to overcome the difficulties, the psychological difficulties related to this very position, because it's not something, sometimes it's not so easy to assume, either personally or socially, regarding the family, etc., etc. So we welcome, of course, lesbians and gays on the coach, if I may say so.
Meenakshi, would you like to add to that?
I think this point that you made, Dr. Rollier, about the mother function and father function is important. But can we read this idea of the mother function to Freudian psychoanalysis as well, or was he talking about the sort of real mother and the real father? Because in gender studies, it's important to prize gender identities away from biological essentialism. So this is very illuminating to see that parents, we are not talking in absolute terms, we are talking in terms of functions that they discharge. But would that be the case in Freudian psychoanalysis as well, as it was practiced? But because Freud seems to talk about, there is
anatomy.
This problem.
Anatomy. I agree with you. Yes, Freud did talk.
So in that sense, Lacan is one step forward.
Absolutely.
Yes.
Absolutely.
Yes.
This idea of a function, which implies the idea of a symbolic order, is Lacan's. For Freud, a father was a man necessarily, and a mother, a woman had to achieve the state of being a woman and being genitally satisfied that way. Yes. He didn't go further, but he admitted it when he said it was a dark continent and he couldn't go further.
I think some of the linguistic terms, the language terms used in Lacanian theorizing is problematic, because it seems to reinforce again this idea of woman as the other, and then he says there is no woman, there are only women, there is no essentialized but it seems to refer back almost to Simone de Beauvoir's second sex idea, where there is a man and there is a woman. But I am sure the way Lacanian psychoanalytic practice has shaped in the last 30 odd years would be very different. And perhaps you could tell us something about that and how that also could be meaningfully related to our endeavors in the field of gender studies and women's studies.
This is a difficult question. Well, the idea that each woman is different from another. We can't say women are like this. Maybe at one time of history it was very important to state that women are a set, and as a set they are very different from men, and as a set they have to claim for their rights, etc. And it remains relevant to speak in that way, but that's not the psychoanalytic way. When someone comes to talk to us, it's not in order to struggle against the society, it's rather in order to try to achieve something, a better life, and get rid of some symptoms. So our concern is to try to have a woman achieve what is really specific inside her and different from another woman. So we don't consider them as a whole set. And regarding their sexuality, precisely, it appears that it is different from one woman to the other. Whether for men, it's roughly all the same story all the time.
I would very much like to know why this essentialism still functions for men and not for women. Is there again kind of a politics behind this?
No, it is
only... A lot of feminists, for example, they think that this is a way to fracture feminist movement, women's movement, and also rock their agencies, basically.
No, the point is only that men function only with the phallic dimension. And women do function in that phallic dimension and in the dimension of other jouissance. They have something specific to them which is unreachable and ununderstandable by men. So that's why it's possible to talk about a set of men. Men do function more or less always in the same way, although of course there are some differences from one to another, but their function, the way they cope with their sexuality is basically the same. As for women, there is this phallic part regarding a partner, but there is also this part of other jouissance which escapes the phallic order and which escape words. And that is specific to women. And that is specific for each woman from one to another, which is going to deal with that in a different way.
We have made some wonderful discoveries along with you, with your help, about Lacan and feminine sexuality. This has been an extremely enlightening experience for all of us, and I would like to thank both of our guests, Dr. Frank Rollier and Dr. Meenakshi Malhotra, for their time, and we hope that the learners also would find this program very useful and helpful in terms of clarifying some of the concepts that they have come across in the MA and in Women's and Gender Studies courses. Thank you very much.
Thank you to you.
Thank you.